Good evening, everybody. Welcome to tonight's Breast Cancer Now Facebook Live. Tonight we are going to be talking about breast cancer and radiotherapy, and I am going to be joined by Joe and Naman from RadChat, who are treatment and therapeutic radiographers. I'll introduce them in just one moment. Just to go through our usual housekeeping before we start. So we've had a couple of questions in advance, and do feel free to put your questions in the comments below. We will do our best to answer as many of your questions as we can live tonight, but if we don't manage to get through them all, we will put answers in the comments over the next few days. So we will do our best to answer everything, but if you don't get your question answered in the live chat, do have a look back in the comments where we will try and answer everything. If there is anything you would like to talk to our nurses about, anything you'd like to run through in person, then our helpline will be open again tomorrow from 9 o'clock. So our helpline's open 9 till 4 on weekdays and 9 till 1 on Saturdays. The number for that is 0808 800 6000. So if tonight triggers any questions for you, or you've got anything else that you'd just like to speak to the nurses about, please do give us a call. You can also contact us in writing if you're more comfortable with that, and that will be through our Ask Our Nurse service. And we'll put the links to all of this in the comments below. You'll also see a link to our survey in the comments as well, and that is for any feedback that you have on the Facebook Live sessions, things you'd like to see us cover, what you think works well and what doesn't. We love to get your feedback so we know how to make these sessions better for everybody. So please do, if you've got a few seconds to spare, do fill in that survey so that we can keep improving these for you. So that is it with the sort of housekeeping. So without further ado, we'll get going with tonight's session. So I would like to introduce Joe and Naman to the screen. Hello, good evening, guys. Thank you for joining us.
Evening.
Hello. So just to start, if I could get you guys to introduce yourselves, let us know sort of your role, your jobs, and your interest in sort of breast cancer and breast cancer treatment, and then we'll get going with the questions.
After you, Joe.
Ladies first.
Yeah.
So evening everyone, my name is Jo McNamara. I'm a therapeutic radiographer and I work at Sheffield Hallam University, and one half of my face is RadChat, which is a podcast and a social media channel dedicated to oncology, specifically radiotherapy and radiation treatments. I have also been a national fellow with Macmillan and sat on the Chief Medical Officer's team, and I also work with the UK Acute Oncology Society and the Society College of Radiographers. So a little bit of everything, but I have a huge interest in breast cancer, largely because a lot of patients that we see within radiotherapy have breast cancer and are going through that treatment pathway. And I know that there is more that we can do to help highlight the treatment, what it is that they go through, and also supporting patients after radiotherapy and spreading the word that the therapeutic radiographer is the person within the healthcare chain that you can kind of rely on to give you all that information. So that's why I'm particularly passionate about coming along tonight. So thank you for having me. And I'll pass on to my other half.
Hi, my name's Naman. So I'm a therapeutic radiographer as well. I work at the Royal Marsden in Sutton as a research radiographer 3 days a week, and I also work for Macmillan Cancer Support in the same team that Joe was in before, in the Chief Exec's office as a national clinical advisor. And then on half of my face is also on a logo with Joe. So my interest within breast cancer revolves around skincare research, which I know we're going to cover a little bit later.
Absolutely.
But yes, I'm hoping to do some research within that in the future, and I'm also involved with the next Fast Forward Boost trial, so kind of links in quite nicely with this. Thank you very much for having me.
Brilliant. We're absolutely privileged to have you guys. You've got such a wealth of expertise and knowledge, so thank you so much for joining us. So if we get started with the first question, I guess the best place to start really is, what is radiotherapy and how is it used in breast cancer? So I think, Joe, you're going to take this one to start with.
Yeah, absolutely. So radiotherapy, unfortunately, is a lesser heard about treatment, when actually about 40% of cancer patients will have radiotherapy at some point in their lives. And actually for a lot of cancer patients with breast cancer, they will experience radiotherapy. It is a type of radiation treatment. So when we think of radiation, we automatically go, I know radiation is bad. That's not something I want to be exposed to. But actually radiotherapy is very targeted. It's very powerful X-rays that we use. So different to the very minimal X-rays that you would get at CT or plain film X-ray if you were to go into A&E. They're much more powerful than that. and we actually target both the cancer cells and normal healthy cells, unfortunately. But with radiation, what we're able to do is ensure that we're just minimising the amount of dose that's exposed to our normal healthy cells, and they are able to repair themselves and repopulate. So they basically go through the cellular process that our body will typically go through, whereas the cancer cells, fortunately, isn't able to go through that process, and that's what damages them, and then the body would excrete them as they would normally excrete a dead cell. So radiation is a highly effective treatment for cancer patients, and from our perspective, when we talk about radiotherapy, there are lots of different types of radiotherapy, and there's lots of different, if you were to just go on Google, which I never advise, but if you were to do that, there are some confusing things that come up. So you might hear about internal radiotherapy or brachytherapy or radiosurgery. So sometimes it's really important to just think about where your sources of information come from. From a lot of perspective from breast cancer patients, typically I would say that they would go and have external beam radiotherapy using a linear accelerator. So a really big, scary looking machine, which I promise is very targeted just to ensure that we're just treating the cancer cells and avoiding as much of our normal healthy cells as possible. So that's kind of a brief breakdown of radiotherapy and some of the little radiobiology aspects of it.
Yeah. And we've had 2 questions that have come in sort of around this topic. So from Amina and Jacqueline around safety of radiotherapy on the left side. And I think radiotherapy safety has improved a lot sort of in recent years, hasn't it, in terms of, as you said, about being more targeted. So it is possible to actually protect the heart for left-sided radiotherapy.
Yeah, the software and the technology that we use now has evolved significantly. When I even look at when I first qualified as a therapeutic radiographer, it's evolved massively. And actually, we're able to really manipulate our radiation beams to target specifically where we want to treat. And so in doing that, we're able to ensure the safety. But also, we have something called deep inspiration breath hold, which is a technique which I'm sure we'll talk about a little bit later. And we also have something called surface guided radiotherapy. So there's lots of things that potentially we do as therapeutic radiographers to ensure the accuracy and reproducibility of what we're doing. So there is always risk with absolutely every cancer treatment that we deliver, but we try and minimise that as much as we possibly can do by being very personalised and very targeted. So we don't have kind of a standard treatment that we give absolutely every single patient. We look at their diagnosis, we look at their anatomy, we look at all of their previous history, and then decide on the type of technique and radiotherapy treatment that we're going to deliver and target it very specifically to that person.
Fantastic. And I know we're going to move on in a moment to talk about sort of side effects with radiotherapy, which I know everybody's sort of really interested in. But just before we do on that line, I think it's important that we sort of chat a little bit. I know we've mentioned about secondary breast cancer as well. And obviously we're talking about breast radiotherapy for primary breast cancer. But in secondary breast cancer, we can actually use radiotherapy in other areas of the body. And it is slightly different, if I'm right.
Go on, Jay.
So secondary breast cancer obviously can go anywhere in our body. So radiotherapy is a really effective pain reliever. So if we were to see a patient who unfortunately had their cancer spread to their bones, it can be used in that targeted way. Again, we're just trying to treat the cancer and save as much normal tissue as possible, but it is highly effective. Another way that we typically might see patients with secondary breast cancer might be if they have brain metastases. So by that I mean that a bit of the tumour has broken off at some point and has gone to the brain. Now, what we used to do, and a standard kind of protocol, was something called whole brain radiotherapy. And that was essentially where we would treat the entire brain. Now some of that has deviated and we still utilise that as a really effective treatment, but you may also hear about stereotactic radiosurgery. And we actually have a series coming out on that soon. So if that is something you're particularly interested in, please do check out RadChat, because that would be hugely informative to just help you make decisions about what treatment you might advocate for yourself.
That's fantastic. That's so helpful. And as you say, it's not so well understood, radiotherapy sometimes. So it's brilliant to kind of hear just sort of how widely used it can be and how helpful radiotherapy can be in lots of different settings. And as I say, I know one thing a lot of people think about with radiotherapy is side effects, as with any treatment. And it's a question we get a lot on the helpline is, I'm due to start radiotherapy and I'm really worried about what the side effects are going to be, how I'm going to feel. And obviously, again, sort of things have improved a lot in recent years. So it'd be great to sort of chat through some of the most common side effects. We have had some questions in around this as well. So asking about, again, the most common side effects of radiotherapy and how you manage them, which was from Sanjana, and also about sort of skin changes and what people can expect. So I know, Naman, maybe this was one that you was going to field. It's such a big topic, but if we could just sort of get a brief overview of what you expect to see with breast radiotherapy.
Yeah, so similar to what Joe said, breast radiotherapy and radiotherapy as a whole has advanced so much that some of the side effects we see are a lot less than they used to be. So 95% of all patients going for any type of radiotherapy will get some sort of skin change. So when you're looking at the breast or the chest area, it might be colour changes to begin with, so with the pigment. So if you have white skin, you might start to see that even after one appointment of radiotherapy, it might go pinker or redder, and then it may look a bit like a tan towards the end of the treatment or a couple of weeks afterwards. And that can continue sometimes for a few months afterwards as well, which is quite normal. If you have my kind of skin tone, so brown or black skin tone as well, it could go more pigmented, which is what we would say looks darker than the surrounding area. Might go maroon or purple discoloration. So something quite different to maybe what you might see on Google. So something that we're trying to work on quite hard through RadChat is to promote some different medical imagery to show the different reactions. But that can usually happen within the first few appointments of treatment. Same with that would be tiredness, which is something that people often talk about. And that can happen even on the first day of treatment. So a lot of patients that I've seen will say that actually the anxiety of coming in for treatment, finding out where you need to go, getting parking, and then going through the first procedure of radiotherapy, so understanding what's going to happen, that fear of the unknown can make them quite tired in the evening. And that's quite normal. And we anticipate the tiredness to get a little bit worse towards the end of the treatment. And we normally say about 10 to 14 days after treatment, it'll probably be more than it has been before. That doesn't mean you won't be able to get out of bed, but it might be that some of the normal things you do day to day, you might just be a bit slower than you have been. And sometimes a treatment can cause the kind of the tiredness to stay for sometimes up to 6 weeks post-treatment, and then you start to see some changes. Those are the two main ones, I would say, to begin with. And they can kind of progress as it goes on. For other kind of side effects that can happen or lead to sort of late effects because of the area that we're treating, sometimes you can get something that's called fibrosis, which is just scarring within the lung tissue. It's a long-term change. It doesn't necessarily mean that the lung function, so how your lung works normally, will be affected, but it's something to be aware of. And also because of in the chest area we have ribs, as we're treating them with radiotherapy as well, just a small amount. It's just something to be aware that if you ever go for a chest x-ray in the future, it's just to let the diagnostic radiographers know so that they're not worried about another malignancy or another problem, just because it's sometimes going to look like a bit of shadowing. It's just something that I've come across before, and it can be quite concerning for some patients.
And am I right in saying it's actually quite common to get some tenderness in the ribs after radiotherapy as well? That's something that we get asked quite a lot, is I'm getting some pain in my ribs sort of weeks, months after radiotherapy. And obviously any kind of pains like that, we would always say to people, go and chat to your team, get it checked out. But it is something that's known with radiotherapy?
Yeah, it's very common. So if you think of all the different nerve endings we have in that area, most people would have had some form of surgery before, whether it's a very small surgery or a full mastectomy. All the nerves that have been damaged during the treatment from surgery specifically, and then the swelling afterwards, radiotherapy will slowly start to wake them up again. So you might get something that feels a bit like a shooting nerve pain in the area, and that can be at any point. It's very common after radiotherapy, and it does subside, but the tenderness is more about the swelling. So Joe kind of touched a bit on the radiobiology side, but as the skin cells are healing and the internal cells are healing to the normal tissue, that swelling is quite common, and it can continue for a few weeks after treatment. Sometimes people, if they don't find it too tender, they can do self-massage in the area. That can help. Obviously, speaking to your clinician about pain relief or using it safely, but even just gentle exercise. And I know we're going to touch on prehab, so I don't want to steal Joe's thunder on that bit. But things like that. And one thing I wanted to point out, is especially around the left side. So some patients can get, I'm not going to try and pronounce the medical term because I tried it earlier and I forgot I can't get it right, but it feels like almost like a heart attack type chest pain. It doesn't mean it is that, but it's a specific pain that happens in between the ribs, so within the intercostal muscles, and it has been noted in evidence quite often post left-sided and sometimes right-sided chest or breast treatment. But it's just to make you aware that it doesn't necessarily mean that it is something that severe. It could be related to the radiotherapy itself, but make sure you get help when you need to.
Yeah, absolutely. That's really interesting. And sort of with the skin side of things, we get quite a lot of calls around sort of skin tightness and how the tissues in the breast, for people that have had breast conserving surgery, so haven't had a mastectomy and have had radiotherapy after, say, a wide local excision, or people that have had a mastectomy maybe have an implant reconstruction in and say actually everything feels tighter, more solid afterwards. Is that something that you hear quite commonly? And I know sort of massage and whether it's okay to put moisturizers on is a really, really common question from people.
Yeah, I would say, and we can share this link with you as well, but the Society of Radiographers in 2020, they came out with a lovely co-designed patient leaflet. So it describes all the different changes that can happen. Actually, all the evidence suggests that there isn't a specific type of moisturizer that's better than another. There are hundreds of clinical trials that occur every year, and there's still not been one specific cream for one specific skin type. So some people might have more oily skin than others, but what we recommend is that if you've been using a moisturizer that doesn't have any metals in, is perfume-free, continue to use that throughout the treatment at least 2 or 3 times a day. And some people I know use aloe vera-based gels. They're okay. They're very good if they're 99.9% aloe vera. However, the gels can dry the skin. So while you're doing a kind of a gel-based regime, you need to have a bit of a moisturizer as well. And just one thing to note, that around the nipple area, because of the amount of nerve endings there are, you may experience that gets a lot more tender towards the end of the treatment and beyond. Sometimes people can use like a wet cloth or a towel, or sometimes a bit of gauze like a bandage, and they'll pop it on when it's really cold. Same with the cream, you can put it in the fridge. It's really important.
That's a good tip.
So yeah, nice and cold. Obviously it's quite cold at the moment, but you might find that it is really nice on the skin. And obviously in the summer as well, wherever we've treated, just speak to radiographers, because we can show you exactly kind of the edges of the treatment field. Make sure that while you're having treatment, you don't put any sun cream in the area whatsoever, because the metallic elements can make the skin reaction worse. But all around it, keep it nice and covered as best possible. And then forever, factor 50 and above. Really, we should always be wearing sun cream 24/7. Not that I say this every time, I still haven't been doing it, but I should be doing it. But it's something to consider, and trying to keep that area best covered.
So is that something people need to consider for the long term, is that sun protection?
Yeah, always.
That's really
interesting. I'd also say as well that sometimes you can get some breakdown of the skin underneath the breast tissue, if you still have breast tissue there, and that's usually an area where it does rub, and we call that kind of dry or moist desquamation. So again, the therapeutic radiographers will be watching you really, really closely, but once you've finished treatment, sometimes because the treatment continues to work for weeks afterwards, that's when actually the skin can start to break down a little bit. It's nothing to be concerned about. It is us, unfortunately, and it's showing that the radiotherapy is doing its stuff. But for cases like that, you wouldn't want to then put cream on it. And there's actually other creams that we can prescribe to use there. So it's just kind of be aware for anyone who experiences that. Just phone your radiotherapy department. We get it all the time where people kind of suffer in silence and then they wait to see their oncologist. And they go, I've got this really bad skin reaction. And we always say as therapeutic radiographers, we wish you'd phoned us soon as you started to see it happen, because we absolutely can help you.
And I remember that from my days in the breast cancer clinics. We'd get phone calls to our breast care nurse line with questions around sort of skincare and what was happening after radiotherapy, and we'd say, please call your therapeutic radiographers because they absolute experts in this field. So we would always sort of defer people on to you guys, because it's such a specialist area. And I think there's such a lot of worry around doing the right thing or doing the wrong thing. It's really handy to have that advice. And as you say, the radiographers are also checking the skin during the treatments.
Yeah.
So there's a lot of sort of care as you're going through your radiotherapy as well. So there's lots of advice out there available. So yeah, I think that's one thing we can promote through this is do please ask if you've got questions. There's always somebody you don't need to be afraid to ask.
Yeah.
Please may I just add really quickly, contrary to popular belief, please don't put pseudocreme on a skin reaction.
Okay.
It's something that we get quite often, and it can make the reaction a lot worse and amplify it to the point where we have to intervene with pain relief and bits and pieces like that. Just be a bit mindful. Exactly as Joe said, we have a lot of very expensive fancy creams that we love to get out of the cupboard, or the dressings that we like to put on, so we can look after you. And yeah, avoid talcum powder as well.
Is that all during the radiotherapy or afterwards?
During the radiotherapy, and probably about up to 2 or 3 weeks post-treatment. And then if you still have a skin issue within the area, I'd say, as Joe said, contact us in radiotherapy and we'll have a look. But try and avoid pseudocreme or talcum powder within the area for at least 3 weeks after.
As you say, the Society of Radiographers information around skincare is absolutely fantastic. There's a brilliant infographic sheet, so I'll send that to our team to get put in the comments afterwards, probably tomorrow, because as you say, that sheet has some really, really sort of helpful tips and advice around skincare, both during and after radiotherapy.
Yeah. It's really frustrating. It's one of our frustrations when people go, oh, I've brought this really expensive cream that someone on the internet promised would stop me from getting a radiotherapy reaction. Unfortunately, that it doesn't necessarily work like that, and we would always say, stick to what you know you're not allergic to or is going to cause a reaction, because we've all done it before, haven't we, with our skincare routine, where you kind of go, oh, I'll add this on, it's supposed to be really nice and expensive, and the next day you're a bit blotchy and you're like, yeah, my skin didn't like that,
and then you look back and think, what was in that?
You wouldn't want to have a reaction on top of a radiotherapy reaction as well. And I would just say, some people like to call it sunburn. It's definitely not a sunburn, it is slightly different. And so obviously a radiotherapy reaction is typically what you'll hear us as therapeutic radiographers talk about, but it can feel a little bit like sunburn, that like tightening of the skin. It can be warm to the touch, that kind of thing.
And I think it's just really helpful for people to know that that is a normal part of the process, that actually these reactions to the skin do commonly happen, and it doesn't mean that something's gone wrong. It actually almost means it's a sign that things are happening in there, and it's actually quite common and to be expected a lot of the time, and that it does, for the majority of people, get better over time.
There's always people that unfortunately their side effects last a lot longer. I mean, you've experienced it.
Everyone's different, aren't they?
Patients for months, years, and obviously the late effects of radiotherapy, which we talk a lot about on RadChat, they don't necessarily happen as late effects from other treatments would. So, we sometimes see patients 10, 15, 20 years later after radiotherapy going through a full diagnostic pathway, because people didn't appreciate that actually, because they've had radiotherapy, it's a late side effect of treatment, and you forget. I'd be amazed how many people keep their consent forms for 20 years after they've had radiotherapy, but as therapeutic radiographers and the oncologists, we definitely see it where people have had quite an extensive pathway to get diagnosed, when if patients just went, oh, I've had radiotherapy in that area, could that be a late effect? It would trigger light bulb moments for lots of healthcare professionals. Absolutely. Going, oh yes, that does look like a late effect of radiotherapy.
Yeah. And I know we want to move on to sort of the rehab side of things, but just quickly while we're on side effects, Naman, you mentioned around fatigue, and I think that is such a common one that we hear about as well. And as you mentioned, sort of people have had their radiotherapy quite often. If they're having primary breast cancer treatment, radiotherapy comes towards the end after other treatments have been given, and also quite often is the last treatment in the active treatment cycle, and therefore people are getting to that point of trying to sort of get back to work and life as well, and the fatigue can actually get a little bit worse after the radiotherapy, and I think sometimes that's quite difficult for people to manage. So as you say, it's so important. to kind of consider fatigue as one of the side effects, and to remind people that yes, this might get a little bit worse before it gets better, but again, that is normal, and a lot of it is around sort of pacing yourself, being kind to yourself, giving yourself that time to recover before sort of going, well, treatment's finished, I need to sort of jump back into everything. Is that something that you guys hear? We hear that quite a lot on the helpline, that actually, well, I finished my treatment, I should be better now, but actually your body's still doing so much healing from everything.
Yeah, we always use the 3Ps, so planning, pacing and prioritising.
Oh, that's brilliant.
Normally find patients will come towards the end of their pathway and they're ready to go back to work the week afterwards, or they're ready to run a marathon, which is fantastic. However, it can be quite challenging then if the fatigue hits very quickly, because then it almost feels like you're going 10 steps backwards. But actually it's about having goals every day, every week. I've had patients who've gone through chemotherapy, surgery, then radiotherapy, struggling to go up and down the stairs, but then a month or two post-treatment, I've seen them do their park run or something like that. So it's, I think, planning, pacing, prioritising. Again, be fully honest, I'm not sure I use that all the time, but it is a really good way to view the treatment. That if one day you don't feel like cooking, that's fine. That's where your friends come in to help and support you, hopefully, or family, put stuff in the freezer or order something nice. And then, prioritising post-treatment what needs to be done, but also just planning to have a day off if you need to.
Yeah, absolutely. And not feeling guilty from it, because that's something else we hear a lot of people saying, well, you know, I shouldn't need to take that time. It's absolutely, do not feel guilty for needing to take some time to, as you say, pace yourself and rest when you need to. And we cover a lot of this. We've got the Moving Forward programme for people with primary breast cancer. So we know that period sort of after treatment is quite difficult to navigate. And so we cover a lot of that on that programme as well, around sort of that pacing, prioritising. It's a brilliant way to kind of remember it with the 3Ps. I'm going to remember that. Brilliant. We've had a couple of questions in that are quite specific around sort of people's treatments. So we may well answer those ones in the comments. But a lot of people sort of sharing their sort of side effects that they've been having from the radiotherapy. So we will, if you are having problems, I would say do make sure you go and speak to your teams if it's very specific to your situation, because your breast care nurses, your radiographers, your oncologists are all there to support you with any questions that you've got. So just to give that slight caveat that please do go and chat to your teams as well if you're having problems. There is one lady who's posted a question around seroma, and I think that's quite an interesting one to quickly try and cover. So this is Rachel, and she said she's waiting for her radiotherapy planning, so the scan that's done before the radiotherapy to help plan the sessions. And she said she's been having seromas, and she's wondering whether her CT is going to get postponed because of that. And I think seromas are quite common after breast surgery. And is that a question that you guys get quite commonly around sort of how to manage seromas when you're waiting for radiotherapy?
Joe, do you want to answer? I've talked quite a lot.
Yeah. Yes, we do see patients with seroma. It is something that people can experience after surgery. Obviously, every patient is assessed individually, but we wouldn't typically do radiotherapy treatment planning if you had a seroma. It's something that we would want to ensure is eradicated before going ahead with radiotherapy. So indeed, it may delay your radiotherapy, but if it is something that is continuously happening, then obviously that might be slightly different, and that would be an individual one-on-one discussion to have with your oncologist and your team.
And there are interventions, aren't there, that the surgical teams and the oncology teams can do. So if it's something you are worried about, Rachel, please do have a chat with your breast care nurses, and they will be able to get you some support with that. But it is something that we hear quite commonly.
Yeah.
Please, might I just add very quickly that sometimes, even Rachel, if it gets better, you start your treatment, sometimes because of the inflammation or swelling that we cause from radiotherapy, that seroma can feel like it's popping back up again, just because there's a space where some of the fluid can go to. It's completely normal. It doesn't mean things are getting worse. It's just to point out that can happen as well. Sorry.
Perfect, thank you. No, that's really helpful. That's really interesting. And that kind of does lead us on to, I know we wanted to talk a bit about prehabilitation and rehabilitation. So I think, Joe, you were going to start us with this one. I know it's an area we're all quite passionate about, so it'd be really good to delve into this one.
Yeah, so prehabilitation is something that I think everyone we would hope would like to be involved in. It essentially means trying to prepare yourself for treatment. You will find that a lot of healthcare professionals and a lot of the media as well talk about prehabilitation ahead of surgery. It's kind of like the focus, but actually every treatment could benefit from prehabilitation. When we talk about prehab, we typically think of 3 pillars. So we think of nutrition, we think of physical activity, and we think of the psychological impact. We spoke a lot about fatigue, and one of the biggest things that I notice as a therapeutic radiographer when I'm talking to patients is the fact that we typically blame all the things that are happening in our body, all our physiology, for the fatigue. I personally think that actually a lot of fatigue is as a consequence of all of the psychological trauma that every cancer patient goes through. I think anyone who's had cancer will know that it is continually on your mind. You know, even if you think, I've finished all my treatment now, I've coped with it really well, you know, it can really, at the end of the day, really knock you for 6 when you're there thinking, gosh, I've just gone through all of that. You know, a lot of our patients will have surgery or chemotherapy, both, and then they'll come for radiotherapy 6 to 8 weeks afterwards. And then they have radiotherapy and it's like, I've just gone through all of that in the space of 2-3 months. And it's a lot for our bodies to take, but I think also for our minds to take as well. And a lot of people around us, being someone who's had cancer, you know, they go, oh, well, you're over that now, you've had your treatment. And that can actually also exacerbate all of those mental things that are happening in our heads, going, well, I can't talk to anyone about how I'm feeling because everyone keeps telling me that I should be fine now because I've finished. So yeah, when it comes to fatigue, I think that can also be an impact, and it's an important part of prehabilitation. So if you know that you are someone that has poor mental health, suffers from anxiety, even has any tendencies to, you know, really spiral when things are difficult, get help as soon as you possibly can do. Waiting lists to access any mental health support in the UK is hard.
Yeah.
They're long waiting lists. So I would just strongly encourage anyone, as soon as they know that they have a cancer diagnosis, even if they're coping absolutely fine, seek some support. What is available to people? You know, Macmillan offer, I think it's, Numan, is it 6 free counselling sessions? You know, that could be something to just get started on to see if that can help. But, you know, from a psychological perspective, prehabilitation is really important. Access that support as soon as you know you need it. If you are already on antidepressants, if you're already under the team for any mental health support, I would strongly encourage you to speak to them about the fact that you've had a cancer diagnosis and that you may indeed need additional support. I think that's just, you know, it's just a really helpful tip for people to really acknowledge, because a lot of the time we just go into full body mode thinking, right, okay, something's wrong with here, I need to sort that out. And we are, you know, we're a whole person and we need to kind of treat everything.
I think I should say, sort of particularly during treatment, a lot of people go into that protective sort of, I'm going to deal with the logistics, I've got this treatment, these dates, and the sort of mental health side quite often gets pushed back to the end of treatment when you suddenly go, oh gosh, now I can process what I'm going through. But as you say, it's so important to put that protection in place at the beginning to help you cope that bit better. And as you say, waiting lists can be a problem in some places, but do speak to your breast care nurses, because a lot of cancer units have cancer trained psychologists, so to sort of get your name down, as you say, early for that kind of support is fantastic. And as well at Macmillan, there's places like Maggie's centres as well where you can access some sort of psychological support. So there's lots of avenues where you can get that help if you need it. So it's just a case of reaching out and asking, and as you say, getting onto that early, getting those coping mechanisms in place is so important for people.
Yeah, and my piece of advice as well is, you know, with that other kind of pillar of prehabilitation is physical activity. Sometimes it can be really hard, because if you've not been physically active before a cancer diagnosis and then thinking, right, okay, well, I wasn't that fit beforehand and now people are telling me to try and be active, it's overwhelming. So everything should be personalised to you. You know, quite often it's easy to read the guidelines, the NHS guidelines around what physical activity you should be doing, and it just makes you feel guilty. Don't feel guilty. It's about you pushing yourself to think, okay, I'm suffering from fatigue. What I really want to do is go to bed, but actually I'm just going to hoover the living room, or I'm just going to walk up and down the stairs, or I'm going to make the effort to get dressed and put on some makeup and I'll just go in the car to do a school run, or I'll just, go for a walk with a friend, or just have someone around for a coffee. That is kind of activity. That's you kind of being up, being active, rather than, what maybe you really want is to lie on the sofa or tuck yourself up in bed. So being physically active doesn't have to be, running a park run. That being said, if you can, this is what the guidelines are kind of pushing us to suggest as healthcare professionals, that it really can help you with your side effects of treatment. So, and also your mental health, if you're able to get out into nature, go for a walk outside. I know it's cold at the minute, but wrap yourself up. It really does make a difference. And if you can have someone to walk with, it's great to chat and just offload and talk about other things rather than a cancer diagnosis can sometimes help. So, trying to be physically active is really important. And there are, again, as you said, Casey, so much help and support around now. There's 5K Your Way and Move charity. We're ambassadors for those charities, and I think it's really important that if you want to start making that change, there's help out there. We don't expect you to just do it on your own. And again, ask your therapeutic radiographers. They'll know of things that are available to you that potentially they might refer you to. Is there a cancer support centre that's got an activity or something that you can get involved in? And quite often they'll do complementary therapies and things. So if you are struggling, you could maybe go along to that. That's you being out of the house and active, but it might also give you the impetus to think, do you know what, I am going to push myself a little bit. I've got a little group of people, I'm going to go for a walk with them. That can really help. And obviously from a rehabilitation perspective, it's thinking about weight training. If you're going through the menopause because of hormones, thinking about the risk of osteoporosis. I know you've done kind of lives and things on this before, but it's just seeking those out and just making sure that you're kind of getting the best help and support, and you advocating for yourself so that you're in the best possible health. The other thing I would say around prehabilitation is, please, if you do smoke, try and cut down or stop. I know every healthcare professional probably nags their patients about stopping smoking, but it is the single thing that you can do that will revolutionise your side effects, because we know from the research that if you smoke, side effects will be worse, the skin reactions will be worse. So even if it's just cutting down and reducing will be beneficial, but if you need help and support in smoking cessation, there is loads out there. We will throw it all at you should you need it. And it's just something to talk to therapeutic radiographers about, and it's never too late. So whoever you talk to on your cancer pathway, they absolutely will know who to refer you to help you to stop smoking. It's January. A lot of people do dry January. Whereas obviously for anyone going through a cancer pathway, we would advocate that they reduce their alcohol intake, or if they can, stop drinking alcohol altogether. It can dehydrate you. I also think, from a mental health perspective, it can have an impact, can increase anxiety and depression. There's nothing worse than having a few glasses of wine and feeling groggy and then having to get up and go for your radiotherapy treatment. Just in terms of your overall health and how you cope with treatment can be harder if you're having to rely on alcohol. So if you can, again, seek help and support should you need it. All of us as therapeutic radiographers and cancer nurse specialists will have advice and support in helping reduce your alcohol intake. And then the other thing is nutrition. So thinking specifically about radiotherapy, it's increasing your protein intake. So when we talk about protein, we talk about kind of meats, pulses, some dairy, and it's having a well-rounded, balanced diet with lots of fresh fruit and vegetables if you can. Cost of living crisis, I absolutely know will be impacting on cancer patients and what potentially they might eat. Thinking about relying on frozen food or tinned fruit and veg is absolutely key. I think it's more about reducing your convenience and trying to get as much protein in as possible. And lots of pulses have a really high protein content. So if you can't afford meat, then it's a substitute that potentially you might want to look at. And again, there's loads of advice and support on lots of charity websites around nutrition, and also through RadChat we've had a few podcasts with nutritionists and also dietitians around kind of how to supplement your diet. So there's a few of mine. Sorry, I know I rabbited on for a bit, but I'm very
No, that
passionate
is
about
absolutely
prehabilitation.
fantastic. And there's so much in there for people to take away. And as you say, sort of around the nutrition and the physical activity, we've got lots of stuff on our website as well around that. And the NHS website has all the stuff about the Eat Well plate, where it can break down for you how to get your protein and your veggies in and everything. So definitely worth having a look and seeking out that support. And anyone sort of feeling overwhelmed, as you say, you can always call us and talk through it, or talk to your radiographers or your breast care nurses, because we can help direct you to the places to get good quality information on the things to do. And one of the things you mentioned there... Sorry, no, go ahead.
Sorry to interrupt. There was one thing I forgot.
Go.
About positioning. So in radiotherapy, we put our breast patients or chest wall patients in a very funny position. We basically get you to put your arms up and abduct slightly away. So if I just put my arms out, you can see my bingo wings there, that's how they look. But what we do is get you to go further back and up and hold poles. Sometimes just one arm, sometimes both, okay? Now, this position is not normal. If you were to do that and kind of stretch back, a lot of people may actually struggle just with that if they've had no surgery, no intervention, no cancer diagnosis. It's slightly difficult, and it can pull on your shoulder, it can pull on your scapula at your back. There's lots of areas where potentially that feels abnormal. Now, when you have any kind of surgery, typically what we find is that position will pull on a scar. If you've had any lymph node dissection, if you've had any lymph node surgeries, you will have scars that will be pulled by that position. So what we do sometimes see in radiotherapy is that we have to refer our patients to a physiotherapist prior to actually starting their radiotherapy. So ideally we like our patients to start 8 weeks after chemotherapy or surgery. If they can't get in this position, we're not able to treat them. Largely because you've got this long bone here, so this is our humerus bone here, and you've got the head of your humerus in the shoulder here. We don't want to treat any of this area, so we have to ensure that it's up and abducted out of the way, so that when we're treating just the breast area, we're avoiding it. Whereas if I come down here, we're going to be treating a little bit of it. So it's really important for us that our patients can get into that position. Now, even if you've had physiotherapy exercises after surgery, they don't always promote that position, which is why people can be religious with their exercises post-surgery, and they're like, it's okay, I've done all my exercises, but they've basically been learning how to do this, whereas we want them to get in this weird position. So what I would strongly advise people to do, if they can, check out the RadChat page, and we have a physio called Kat Tunnicliffe that we work with from Percy Health, and she's amazing. Yeah, really lovely. And she basically has done a whole series of videos of the best exercises to do. And what I would strongly say is that from Kat's perspective as a physio, she always says that you have to do these exercises for life. So radiotherapy causes fibrosis. Unfortunately, it's the gift that keeps on giving. But because of that, you will have to do the exercises for 3 minutes every single day for the rest of your life. It sounds really overwhelming when you say it. You're like, oh my gosh, how am I going to remember that? Her tip, do it when you brush your teeth.
Yeah,
so
it's about working into your routine, isn't it?
Brushing your teeth, and you are doing your exercises, and you don't. It doesn't even have to feature anywhere else in your day. But it's a really strong tip from Kat in terms of prehabilitation and also rehabilitation to ensure that you don't have any shoulder dysfunction years down the line.
That's fantastic. That's brilliant, because that's one of the things that I was going to say, because you mentioned about physical activity, and a lot of people ask us about sort of the exercises after surgery and before radiotherapy. So that answers that question for people, that actually this is something you may have to work into routine long term. And, you know, these things, they're always difficult at the start, but as it becomes part of your daily routine, it just becomes, like you say, with brushing your teeth, it's automatic. It's not something you have to think about. But I think that's something that certainly I didn't know that that's recommended sort of long term. So that's really, really helpful for people. And you mentioned around sort of the prehabilitation, sort of physical activity, how helpful that can be. We had Caroline Tweedy on Thursday, who's an exercise specialist and breast care nurse, and she brought up this brilliant idea of exercise snacks. So if that sort of big gym session or big long walk or the big run feels unmanageable, those kind of very short, sharp little interventions like I'm going to get up and walk up and down the stairs, I'm going to stand up at my desk, all those kind of little things all have benefit and it all adds up. So if the big picture is just too overwhelming, as you said, just kind of focusing on those little wins can be really helpful for people.
I thought you were going to talk about exercise snacks there. I got really excited.
Protein bars.
Yeah, so protein, that's where you get it in.
Can I just add a very quick resource around the physical
do.
activity? Cancer Care Map. If you put your postcode in, they'll give you all sorts of different community groups. They might only be catering for 2 or 3 people, but it'll be within your community all across the UK. And they update it very regularly, so that's really good. Joe talked about the positioning. There's some resources that I think, Joe, you helped with Professor Heidi Prost at Sheffield Hallam, so the Respire resources. So that's for people going for breast or chest wall radiotherapy, free breathing, or in breath hold. But it has loads of clips, some good relaxation videos and bits and pieces like that, which are really good.
Brilliant. Yes, we've got that link in our radiotherapy web pages. They're absolutely brilliant, just little snippet tutorials for that breathing technique. Because again, it is something that isn't necessarily a natural way we're used to breathing. So you actually have to take that time to learn how to do it, which I think some people don't realise. So those resources are fantastic.
Yeah. And the last thing was, if you're going for your CT scan with us or radiotherapy, our rooms are quite cold, and they have to be to keep the machines cool. So we had the privilege of having Dr. Liz O'Riordan come on, and she wore gloves or just long socks, cutting them down, putting them on her forearms, or wearing a hat. Especially if you've had chemotherapy, you might be a bit more sensitive to kind of temperature changes. Just something to consider. But you can also bring in a blanket. We'll probably have a blanket on the unit anyway, but I'd probably say if you have something a bit thicker or a thick coat, just bring it in with you, because we're only looking at just above the kind of the chest, the diaphragm area, to the bottom, just underneath your breast or chest. So yeah, you can keep yourself covered and a bit warmer than our rooms are.
Yeah, that's really good advice. I think that's, again, something people don't think about, is the fact that actually the rooms are quite cold.
Yeah. Maybe moisturising as well is something we've maybe not emphasised enough as part of the prehabilitation. As soon as obviously your surgical scar is able to kind of withstand cream, it's not open, it's not oozing, you've got no infection or anything like that, then start straight away moisturising. You want to get as moisturised as you possibly can do and well hydrated. It will just mean that your skin can cope much better with the radiotherapy. So drinking water, trying to reduce tea and coffee, which is a diuretic, so it will make you go to the toilet. So, you know, we don't want you to have a really boring life and have to withdraw from all your usual things, but, you know, trying to every morning lather on the moisturiser. You know, if you can go without a bra, get as much air as possible to that area. I know I've had ladies before who've got a fan and they've just kind of sat watching TV with their arm up, lathered in cream and a fan on, and that's helped them cope with some of the skin reactions. But again, a great way to be able to kind of prepare your skin is to drink lots of fluids, and ensure that your skin is as moisturised as it possibly can be.
I think that's something people wouldn't think about, isn't it? It's the fact that it's actually physically hydrating by drinking as well as hydrating the skin.
Sorry, I was just going to add, if you use bio oil for your scar, really good to help with the scar. But when you come on to start radiotherapy, make sure you stop putting bio oil on the scar, just because it's an oil, it can kind of amplify the reaction in the area. So at least, probably I'd say maybe 2 or 3 weeks post-treatment, and then you can restart putting bio oil on the scar itself. Brilliant.
And the other one we get asked about a lot is deodorants during radiotherapy. Is it safe to put deodorants on?
It is. There's a lot of evidence which said contrary, but if you use some natural deodorants, what we say according to the Society of Radiographers guidance or the leaflet that we've been talking about, it says that you can continue to use it up until it becomes irritated. So quite often, actually, we won't be treating into the armpit area, exactly as Joe showed earlier. So that is something that is okay to do, and trying to dry shave if you wanted to as well. You can also go swimming, which I think before has been said you're not allowed to, but we say just go swimming until, or if your skin isn't intact anymore. So if you have that kind of desquamation, as Joe explained, kind of skin breakdown or any irritation, if you're going in a pool that's indoor, I would say try and go in the afternoon. So in the morning is when they put a lot of chlorine in, just so it's not feeling too rubbish on your skin. And if you do notice any irritation, obviously try not to go swimming.
Brilliant. That's really helpful because swimming is so popular for people trying to get back into that bit of physical activity because of the sort of buoyancy and the support you get. So it's brilliant for people to know that they can do that. Fantastic. Well, we're at the end of our time. I know there's so much more that we could talk about.
Sorry.
I really wanted to get onto the fast forward trial as well, which we've not managed to, but we may well have to do this again. And thank you for getting through so many of people's questions as well. There are a few that we haven't managed to get to, so we will go into those in the comments over the next few days. But I just wondered from both of you, if you've got any sort of final thoughts that you want to pass on to everybody before we finish up for the night?
I'd probably just say try not to worry if you're sitting next to another breast cancer patient in the waiting room and you're talking about how many treatments that person's having and what they've gone through, because radiotherapy is very personalised. So I know we haven't talked about dose and prescription and the number of treatments that people have, but essentially everyone has their own personalised prescription, exactly as chemotherapy. You know, you wouldn't give one chemotherapy drug to absolutely the same amount to absolutely everyone. It is very personalised, and that's exactly the same with radiotherapy. So try not to compare yourself. We've looked at you as a whole person and your diagnosis, your histopathology, and we've gone via the guidelines as to what the dose and prescription should be. There's also lots of terminologies in radiotherapy that might be applicable to you that we've kind of just briefly mentioned, and if you did want to find out any more specifically about radiotherapy, then our whole kind of Instagram and Facebook page is dedicated to it, so please feel free to ask us any questions on there as well.
Perfect. Thank you, Jo.
I would say just don't worry about our time. We're here to support you through your treatment. Please just ask us questions, or get in touch obviously with the wonderful breast care nurses that you work with as well. But we're all here to support you, get you through treatment and beyond. So we'll do what we can.
And that's such a fantastic message to leave for people, because we hear so often people calling saying, but my team's so busy, I just don't want to bother them. And we always say, no, please do. Everybody would rather you called if you had a concern than sat at home and worrying. As you say, it's what we're all here for. Everyone's here to help people through what they're going through. So please do always pick up your phone to your teams. Definitely, that's amazing advice. Thank you so much for joining us tonight, guys, and you've got through so many questions, so really, really appreciate that. We will put links in the comments below to all of the resources that we've talked about and to the RadChat podcast as well, because it's a fantastic listen for people going through breast cancer, other kind of cancers, as well as for healthcare professionals. So really good resource. We'll link that below as well. Just to say to everybody, again, we will answer comments that we've not managed to get to in the comments below. Or you can always call our helpline if you've got things sort of more specific that you want to talk through, or anything has worried you from what we've talked about has triggered questions. Please do use the helpline and give us a call. And just to remind you, the number for that is 0808 800 6000, and it's open again from 9 o'clock tomorrow. Just to promote as well, our next Facebook Live is going to be on the 25th of January, and that's a Q&A with the breast care nurses, so that is with Louise and Jane. So you will be able to send in your questions on anything to do with breast cancer and breast health that you'd like to ask the nurses. So that is on the 25th of January. But for tonight, that is it. So thank you for joining us, everybody, and thank you, Jo and Naman, for your time. Really, really appreciate it.
Thank you.
Thanks,
Take care, everyone.
Evening, everyone.
Bye.